Well, hello, and welcome to my case study on child maltreatment. 5-year-old CT was brought to the community hospital emergency department by his mother for excessive sleepiness. I'll never forget, it was a Thanksgiving day. I was working in the pediatric intensive care unit, and I was a member of the transport team. And we received a call, as we very routinely did, from the PICU to go out to community hospitals and pick up very sick children and bring them back to the intensive care unit. So this was a unique day because it was a Thanksgiving day. We had all brought in potluck meals to share for Thanksgiving. So the transport nurse went out to go get CT and brought him back to the pediatric intensive care unit. Whenever the transport team receives a call to go pick up a patient, very importantly, we receive the weight of the child. We take that weight and we calculate all of the emergency medications that we may need to administer. And when the transport call came in, they told us he was 5 years old and he weighed 18 pounds. We very quickly thought, well, they must have meant kilograms. There's no way a 5-year-old could be only 18 pounds, but he was. Upon examining the child, he had excoriated skin on the bottom of his feet, multiple marks all over his body. Through x-ray, we were able to tell that he had a healing rib fracture and he had multiple missing teeth. Again, the weight of an 18-pound 5-year-old is 8 kilograms, which is the size of a 12-month-old, and he was 5. He was severely dehydrated and severely malnourished. If he wasn't brought in that day, he most likely would have died very soon. He was barely responsive, very listless, had very dry, cracked lips, sunken eyes. So the assessment, to recap, it was child maltreatment, physical abuse. Burns were on the feet. CT was made to stand in boiling water. He had whip marks on his body of various stages of healing. He was severely malnourished and dehydrated. So the plan, pens up. As a nurse, you are a mandated reporter. In your professional work, if you suspect abuse or neglect, you are mandated to report that to Child Protective Services. When it happens in the hospital, you also need to notify risk management and social services. Medical care consisted of rehydration for CT, intense skin care. CT spent 6 months in the hospital, and then he was placed in foster care where the foster parents were going to adopt him. That didn't quite work out, and he was adopted by his grandparents. The parents did go to jail. CT received much psychotherapy because of this. Another kind of personal pens up for you when you are dealing with any type of situation like this. You need to be very careful about protecting the rights of your patient. So this was a high profile case. It was on the news, especially because it was Thanksgiving. So we had lots of reporters trying to get to the unit to take pictures. They would do anything, lie and say that they were family members. They tried paying off some of the family members who were able to get in and were able to purchase videos. of CT riding his tricycle through the halls of the ICU. You need to be very careful about protecting the rights of your patients. So there were some red flags for sure. And why was CT able to go on so long? He had suffered years of abuse. Child Protective Services were called to the home multiple times. Parents were living in poverty, and there was a high drug abuse in the family. Other risk factors for children who are abused include children who are born premature, have cerebral palsy, chronic illness, and intellectual disabilities. Another risk factor for parents to abuse is extreme stress. So the nursing assessment, whenever you're caring for a child that you suspect abuse, number one, you always want to see if the history is consistent with the injury. In CT's case, we did not need the mother's history to identify this child was abused, neglected, and maltreated. But if the parents or caregivers are available when you are caring for a child that has been maltreated, you always want to see if the story is consistent with the injury. For instance, I had another baby that I cared for that the parents had said that the baby fell in the bathtub and was brought in unresponsive. The baby was brain dead and had to be taken off life support. And through MRIs, CAT scans, it was found that there's no way that a baby could have sustained that level of injury by just falling, but the child was injured. It is one of the most difficult situations to have compassion and care for the child and remain free of judgment and care for the patient. You also, in your nursing assessment, want to ask the child if they're verbal, if they're afraid of anyone at home. You want to ask the parents, do you ever feel like you may hit or hurt your child when you're frustrated? Because as nurses, we want to try and prevent child abuse and not just care for children after they've been abused. You want to assess for risk factors. Also, looking for inappropriate sexual behavior of a child is a sign of sexual abuse. You also want to note any sleep disturbances or other symptoms such as headaches, stomach aches, or frequent sore throats from sexual abuse. And again, remember that as an RN, you are a mandated reporter. Thanks.